Nestled in the northeastern part of Kenya, Wajir County is a region rich in cultural heritage and resilient communities. Despite facing challenges such as limited healthcare access, frequent droughts, and a harsh environment, the people of Wajir continue to demonstrate remarkable strength and unity. Today, the county is not only known for its vast landscapes and pastoral lifestyle, but is also a focal point for addressing pressing health issues, including the rising cases of kidney failure, a condition affecting more and more lives across the region. Kidney failure has increasingly become a major health concern in Wajir County over the past few years. Once considered a rare condition in the region, it is now affecting many residents, with an estimated 100 people currently undergoing dialysis.
The number of patients attending dialysis service in Wajir County is 79. 31 are attending public hospital, while there are 48 they are attending their service in public hospital. Sex distribution, the number of female are 21 total and male 58. Comorbidity, the total number of patients who recorded history of diabetes are 8. The other thing, history of hypertension is 60. Those who reported history of hypertension is 60.
One such patient is Ahmed Mohammed, a 30-year-old single father of 2 who has been on dialysis since 2018. Born and raised in Wajir, Ahmed's life took a drastic turn when he was diagnosed with kidney failure 6 years ago.
I was diagnosed with kidney failure in 2018. At that time, there was no dialysis unit in Wajir, so I was referred to Garissa and later to Nairobi, where I stayed for 1 year and 2 months. It was only after that that a dialysis unit was finally opened in Wajir. Back then, we were about 200 patients, but sadly, most of them are no longer with us.
The increasing number of kidney failure cases in Wajir has put immense pressure on local healthcare facilities. The Wajir County Referral Hospital, which provides dialysis services, is struggling to keep up with the growing demand. Patients must undergo dialysis multiple times a week, a costly and physically draining process. Although there is no single known cause of the increasing kidney failure cases in Wajir, health experts tell us several factors might be contributing to this crisis.
This is Dr. Rashid. I'm a physician at Wajir Referral Hospital. So we're here to discuss chronic kidney disease, which is very common in Wajir County. And it usually entails failure of kidney functions, which leads to a lot of waste staying within the body, and that leads to eventual death. So the common causes are diabetes, hypertension, infections, tumors, use of miraa, and smoking.
In Wajir, most of the water is from ground. We have two sources of water. We have surface water and underground water. Mostly in Wajir, we are getting underground water from shallow wells and boreholes. And water from underground has a lot of minerals. There is lead. And lead will definitely affect the kidneys. High levels of lead will affect the kidneys in water.
Alarmingly, more young people, including school-going children, are being affected. Despite the growing prevalence, many residents remain in denial about their condition, delaying essential medical interventions such as dialysis.
At first, when I was diagnosed with high blood pressure, I didn't take my medication seriously. I just couldn't believe I had it. But now, after 4 years on dialysis, I thank God I'm doing better. People always tell me, if only you had taken your medication properly, you wouldn't be here today. So my advice, please take your medication as prescribed. It can save your life.
Healthcare professionals in Wajir have observed a worrying trend. More people are being diagnosed with critical kidney diseases but continue to live without seeking proper medical care. Some are aware of their condition but choose to ignore it, while others remain undiagnosed due to a lack of awareness of medical facilities. Health experts in Wajir urge the residents to go for regular checkups to safeguard their kidney and overall well-being. Prioritizing prevention today can save lives tomorrow. Quresha Ali.